For those of you who aren't familiar with CQL's vision, it is a world of dignity, opportunity, and community for all people. Our mission is that we are dedicated to the definition, measurement, and improvement of personal quality of life. CQL accredits about 360 organizations in 25 states and Canada, Ireland, and New Zealand. So very exciting. Some of the benefits are some of the benefits of accreditation you see on this slide here. This information has come from many of our partners when we ask them what they think the benefits are. So they share different ideas and talk about the value and benefits. So today we're going to talk about why evidence is important and what kind of evidence we look for when CQL comes to accredit your organization. And just to note, we'll say this probably several times throughout the webinar, but not all agencies will provide the same types of evidence. It really depends on the types of services the agency is providing and where those services are provided. So, obviously the evidence is going to look different. It offers us an objective perspective to see the different types of evidence you produce. It's also typically measurable, and typically the systems and practices of an agency are the foundation that agency is built upon, and then helps us know where to start. It gives us time for reflection when we're going through the evidence, but it also gives the agency time for reflection also. It can also help identify what's working well, and then it flags opportunities for improvement. One thing about evidence is that we want agencies to be, completely transparent. And it's okay if you don't have 100% of the basic assurances in alignment. We just want you to be very clear about your evidence. So Jackie McKnight from Empower Senco, who is an agency that's accredited by us, really talked about how the policies and practices of the organization has set her agency up for success. Kristen, do you want to take it from here? Talk about different types of evidence?
Sure. So there's two types of evidence that CQL will be looking at during an accreditation: the system and the practice. The system is the very concrete, tangible, brick and mortar kinds of things. So policies and procedures, forms, assessments, those kinds of things, which the policies and procedures, we're really going to be asking some more questions around them rather than just looking at them. Like, where are they located? Who has access to them? How do you train on them? So looking at the policies and procedures, forms and assessments are always great to look at. Again, we'd like to see them possibly filled out so that we can say and see what one looks like filled out, as well as the follow-up as to what you all are doing to help the person. So for instance, if Kate were to have a rights assessment and say that she would like to go to church, what is the follow-up with that, so that we can kind of see how the loop is closed? Training, great to see training for people supported, for families, as well as for staff. And we'd really like to look at those kinds of things. Storytelling. Storytelling really induces a lot of different emotions, and it's a really great way to tell humanized stories as types of systems evidence. Personal outcome measures, for those of you who know about the personal outcome measures, a lot of these will align with all the factors that we'll talk about. And handbooks. So you have a basic assurances handbook that has a lot of really great information within that. So that is the systems area, which is, again, very concrete. Here's another quote if you want to read it, from Josh Wilson of Independent Case Management, Inc., another one of our partner organizations. The second type of evidence that we're looking for is the practice. And this is really where we find out the culture of your organization, if your policies and procedures are actually being enacted throughout the culture in the organization. So one of the ways we get this information is by focus groups. We do a variety of focus groups. with people supported, direct support professionals, frontline supervisors, families, employees, just to really get people's perspective on things. And this is really nice way to get really concrete information, but also we can observe how people's language is, how their body language is, things like that. So really, by looking at practice, we'll be observing all kinds of interactions throughout the organization. Visits with people. We don't visit buildings. We'd like to talk to people in their homes ideally, but to really talk to people and get an understanding of what their lives are like. Again, the personal outcome measures is part of this practice as well. And then conversations with various stakeholders. A lot of the practice is just really seeing the culture and finding out through observation what is happening. All right, so for each of the factors, we're going to talk about system and practice evidence, some traditional and non-traditional forms. So factor one, rights protection and promotion. So policies and procedures around rights. Again, we utilize, and we'd like you to utilize the United Nations Declaration of Rights. So really wanting to see those policies and procedures of how important rights are within your organization. Rights trainings. Again, this isn't just trainings for staff. We want to see how people supported are learning about their rights, and families, and just to really get an idea of what that training looks like. So again, when we're talking about rights, we're looking at global rights. So it can be anything from employee rights, tenant rights. So really we are looking at rights across the gamut. So we're really going to want to look at your person supported, as well as your employee handbooks, any handouts that you give out on rights, conversations around rights. Rights assessments, again, we'd like to have those completed so we can see what rights are important to people. And the Human Rights Committee minutes. And this is a great area where you can really show how diverse and effective your Human Rights Committee is. So, you know, making sure to include all the information around there as to people attending their human rights meetings, who's in attendance and conversation around there. All of this will give us a really great idea of what systems are in place to ensure that people's rights are protected and promoted. As for practice, again, it's going to be those conversations around rights and observations. Do people know what their rights are, and are they actively practicing them? Focus groups will give us a really great idea around that. Examples of advocacy, again, those really great stories of people talking about times when they have been promoting their own rights. The agency culture and visits where people receive services. Human rights advocacy, so again, looking at human rights advocacy is a global thing for all marginalized people and people in general. And again, success stories for people exercising rights. And when we talk about success stories, it's also important to say stories that aren't necessarily successful. So stories of where you've tried really hard and maybe it didn't turn out the way that you expected, but just those great stories that really illustrate a person who maybe wanted to try for guardianship and all of those things. So this is factor one. Would anyone like to add to factor one? Okay, I think you had.
Kristen, I just wanted to add, sure. Yeah. I just wanted to add that in the Human Rights Committee minutes, those are typically very rich with information. Mm-hmm. And some of the things that we look at when we look at Human Rights Committee minutes is, what is the committee discussing? What is the committee endorsing? You know, what are they saying that's okay to do and what's not okay to do? So those are some of the obvious things. But another thing that we look at is, you know, if a Human Rights Committee minute or if a Human Rights Committee meeting takes an hour and you're looking at, you know, 45 different, you know, rights restrictions that the Human Rights Committee is looking at, you know, that's not a whole lot of time. I mean, that's just over a minute for every restriction that the committee is addressing. So, you know, that's just another piece of information that we would find. And just to reiterate, we really like to see, you know, any forms or anything that your agency does completed, because that gives us a lot of insight into, you know, how those forms are being used. So thank you, Kristen.
Yeah, great points. All right, factor two, dignity and respect. Again, this is one where dignity and respect is something you know if you see it or you don't. But the really tangible parts around this would be policy and procedures, training, conversations with your staff and people supported around dignity and respect. Employment falls into this category, so we'd really like to hear about great successful employment opportunities that people have found within their communities. So that would be a great data point. Autonomy and choice. Are people choosing how they want to spend their day and from a variety of options? And what does that look like? Privacy and confidentiality policies. Again, privacy and confidentiality are extremely important when it comes to dignity and respect. So what does that look like? How are people trained on that? Satisfaction and complaint data. And this is where diversity, inclusion, and equity really fall into this. So how is the organization working on diversity, inclusion, and equity within their organization? And choices. Do people truly have the choice to live the lives that they want to? And when you're thinking of these factor areas, you can also think about what personal outcome measures really fall into these categories as well. All right, so practice. A lot of dignity and respect is very visible. So agency culture, what kind of language are people using? How are people talked about when they're not there? What is the overall way that people even treat each other? So a lot of that is observable. Visits with people, observation of all interactions, language. Again, the focus groups, really asking people, do you feel respected? Community partnerships. So what kind of integrated partnerships are happening within the greater community? Routines. What are people's routines? Do they have to go to day program? Do they get to choose their day program? Do they get to choose their dream job? So really looking at all of those and how, when there is a concern, how that is really rectified to the person's, how they would like to have it to be a solution to that. All right, factor 3. Natural support networks. Again, natural support networks are really unpaid relationships that people have, and you know how important that they are, but we're going to look at your policies around relationships. For instance, are there rules unwritten and written that, you know, don't let people have visitors at their house, don't let them explore friendships, things like that. So we're going to really be looking at those policies around relationships. Along with that is, how do people supported get education, experience, and exposure around relationships? Staff training around relationships is very important, as well as emerging support networks. So do staff know how to help a person find social roles within their community? Response to complaint and concern data from friends and families. What does that look like? Do families feel like they're responded to? Is there a record of this data that's very hardy and can show us a lot of information? Examples of community partnerships. Again, community partnerships are a great way for people to find relationships and social roles and just all this really rich stuff that comes from community partnerships. Communication strategies. How are families communicated with? How are friends communicated with? Do people, unpaid supports, come to people's planning meetings? Are people given the access to relationships that we all have, and are barriers being put down to help them? So practice conversations and visits with people. Again, the personal outcome measures factor area that goes perfectly with this is people are connected to natural supports. It's a type and frequency one. So are people doing what they want to do with people and with whom they want? So that's really at the gist of it, as well as people having friends, people having intimate relationships. And a lot of this is found out by talking to people. Families, focus groups, just conversations in general. Examples of how technology is used for relationships. Again, we've talked about this a lot during the pandemic. A lot of organizations have done amazing things with technology to keep natural supports in the loop and to help people stay connected. And finally, success stories. I know we keep coming back to the stories, but what has been done to help people find their people, to help people have relationships? And again, they may not always be success stories. They might just be stories of times that people have tried really hard to meet people and it hasn't worked out, but really seeing the learning experiences from them, and also thinking about, you know, those really those generic kind of relationships that happen by chance. So through coworkers, church groups, these naturally occurring social areas that we have, and how that can also lead into natural supports. So that is factor 3. Betsy, factor 4.
Thank you so much.
Yeah.
So as we move into factor 4, protection from abuse, neglect, mistreatment, and exploitation, this is a really perfect quote by Louis Armstrong. Shame on you if you don't treat us well. So that's perfect. Perfect to start this. I also want to, go ahead, Kristen, to the next slide. I also want to share with everyone, if you have your basic assurances manual in front of you, for example, factor 4, on page 23, there's procedures for information gathering. You know, a lot of times people don't necessarily do this, but focused conversations with people prior to CQL coming is a great way to gather information. In that area, there's suggested questions for the person and questions for someone who knows the person best, and areas that you want to look to analyze and explain to us. So of course, policies and procedures are big. This is a very regulated piece for all states. But we looked at how support staff are aware what the organization, local governing entities defined as harm, and how to prevent and recognize and act should they witness something, some type of abuse, neglect, mistreatment, or exploitation. We also want to know what the definition is of abuse and neglect from the perspective of the person. It's very important so that we can have all people be free from physical or mental harm in any environment or any situation they're at. Strategy and trends analysis or action, of course, we're going to be taking action related to many trends and patterns in incidents, injuries, deaths, sadly, psychotropic medications, behavior support plans, any restrictive interventions. We want to make sure that you have a system in place to track any incidents, injuries, and so you can respond to any trends or safety concerns. Sometimes injuries are of an unknown origin. And so we want to be looking for those types of trends. We're going to want to be looking at incidents and risk assessment. Sometimes when someone's been part of abuse, neglect, mistreatment allegation, and they have bruises of unknown origin, you're going to want to do a risk assessment, because then you're going to be looking at alternatives to support them around things. Any incident management actions we do with people is all around what kind of people are doing the incident investigations, what kind of training do people have, you know, do you get regular training around that? How you do those, how often you do those, how fast you do those. You know, you want to make sure that there's training for staff and people supported and families around abuse, neglect, mistreatment, exploitation, prevention, because it's important for staff. We've all been raised and grown up in different environments and different areas. So we want to make sure everyone clearly understands what these pieces mean. I think the biggest portion, particularly in our day and age, is exploitation. Exploitation, you know, particularly in our world of technology, has gotten pretty big, where, you know, we talk about people have friends, and people will often say I have 1,000 friends because it's Facebook, or they're on some other you know, chat device or something. So we want to make sure that people are safe around those types of things. Internet is great, technology is great. We just want to make sure people understand, you know, what's going on with all those things, including staff, and what are the boundaries for them and also for families. You know, why is data important? Because we look at trends. We look at trends where, say, for example, if you have a high level of incidents happening in one area of your organization, and then you're going to look to why it happens. You're going to look at, is that the same person? Is it the same staff? Is it the same site? Or is it happening someplace else? And how you can use that data to offer different training. And then, of course, external reviews are always important to look at and see what kind of incident reporting systems you have with your state systems. And in practice, focus groups are great. You know, when CQL comes to visit, we do focus groups with people and to see what they know. What is their definition of abuse, neglect, mistreatment, and exploitation? We want to make sure we visit with people, check out how they're responding to staff, check out staff interactions with people. You know, culture of respect and transparency is huge. It's pretty easy to tell an organization when you see this. It's shown when organizations really embrace a positive organizational culture of respect and appreciation and actually camaraderie among everyone connected to the organization. It's shown through open communication and sharing up with follow-up information and so on. We want to make sure, we talk about education, experience, and exposure. A lot of people sadly have been exposed to or experienced some level of abuse. We want to make sure that people get support all the time. We know abuse doesn't go away, it's managed. We want to have organizations think beyond the present situation people are in. People may continue to experience pain or physical or mental things from previous incidents of abuse. So whenever you're aware of any harm, past or present, always appropriate individualized supports are important to assist a person in coping with the event. Make sure the intervention practices are effective, and person outcome measures and focus groups really gleans a lot from this. Family residences and essential enterprises shared that POMs really help people understand what they want to do with their best possible health. As we move into talking about best possible health, there's a lot of systems, again, another area that's pretty well regulated. But when you think about policies, we want to know what systems promote and support people's healthcare needs. We want to see that the policies are strong when it comes to the systems and practices around people getting regular doctor's appointments and evaluations. We want to know that policies actually speak to people's definition of best possible health. And what does that mean? Moreover, people want to be or should be involved in their own healthcare, including decisions and healthcare providers and services. So those big policies, we want to really look and see at how robustly you have that person, families, people involved in what that means. If they're doing medications, we're going to look at medication records. We're going to be looking at how active people are involved in those things. We're going to be looking at, do people have medication assessments and what that looks like. We're going to be looking at staff training around medication and how people are doing with their medication, and as well, what kind of errors are going on and what's going on with that. Of course, incident reports is a system which we use that because we're looking at best possible health. If people start struggling with their health, they might start losing sight, they might struggle with an injury or something. Incidents reports can glean those types of things we want to change for people. ER hospitalization records, data regarding people managing their own healthcare, that's key. I mean, it's so important for all of us to know what's going on in our lives, particularly around our healthcare, choosing our own doctors, deciding if we want to go to this doctor. Now, albeit I get that, I have had to go back into network when I wanted to be out of network because I liked a particular doctor. So we all have to make those financial choices around managing our healthcare, but within those areas, we still have choices. And sometimes it might be something small, like I'm going to be sitting on the phone while you have it on speakerphone, and I'm going to listen to you talk to the doctor, and I'm going to help you schedule an appointment. Another system we might be looking at is sick days and illnesses of maybe staffing or people supported. We want to be looking at the type of PR and medications that people have, particularly around psychotropic medications, and how effective they are, and do they actually align with the diagnosis or behavior, or the behavior of the diagnosis that someone has. Of course, external reviews, which would involve those incident reports, and certainly personal outcome measures, best possible health. When we think about practice around this, best possible health, people define what healthy is for them. And so often we hear, well, eat a salad, don't eat candy. But I'd love to hear people say, I want to keep going to the gym, or I want to do this. During pandemic, I talked to an organization who really missed going to the gym, and they were able to get a trainer to come out and exercise from an appropriate distance to do his exercises on the front porch. So that was pretty cool. Conversations with people, focus groups can be conducted with people supported and families and others. It depends on the types of the services people get. Best possible health, when you think if you're working with an aging population of people, what does that mean for the family? What does it mean for them? How can you support people to be healthy emotionally when their husband may have dementia? Those are very important. Or how do you support families around that don't receive some type of residential service to really support them and get their regular health care screenings and evaluations that normally, say, a nurse in an organization would do. So how do you do that in both system and practice? Let us see what visits are with people who receive services and how interactions are with people. Education and training for staff and people supported on managing individual health care. We want to make sure we're doing with, not for, when it comes to all aspects of people. People should be reciprocally involved in all their healthcare services. Okay, thank you. Let's go to factor 6. Love this quote too by Jerry Smith. I love the penny. You know, safety is not expensive, but it's priceless. When you're not safe, it makes all the different world in all of your lives. So of course, we're looking at strong systems and policies. You know, when you look at your basic assurances manual, you're going to be looking at areas that you want to make sure people are safe. You can't guarantee necessarily total safety and environment. We also include dignity of risk for people, but you need to have reasonable precautions that you take. And we'd be looking at those in policies, looking at due diligence to ensure environments where people live, work, and spend their time recreating, you know, so they can all be safe. Incident reports we look at because how many times are incident reports filed because there was an accident, an injury, an unknown cause. So clearly incident reports are looked at and the follow through with them as well. Personalized assessments are so valuable for people that you support. Do people get individualized assessments in their environments? And do they get individualized supports for those? And what does it look like for them? And are they personalized to who they are as an individual? We, of course, look at surveys and reports from external licensing and certification entities because that is another robust system you already have in place around safety. Safety committees I really love, and I love safety committees that are very involved. I remember doing an accreditation with an organization, and I was doing Factor 6 review, and there were over 25 people in this factor discussion, people supported, facilities directors, and so on. And the reason why I loved it and had that conversation is they were so excited about the safety piece and keeping people safe. And people supported were involved in that and also involved in doing inspections. Staff training records we look at in terms of what people are trained in regard to safety and has any lapsed, and if is that correlated to an incident that may have happened. In terms of practice, certainly we look at personal outcome measures and what safety means to people and what their definition of safety. Sometimes being safe doesn't rise to the level of an incident based on our practices, but when we look at that, we want to make sure that people's definition of safety is looked at and recognized. We look at assessments that are completed, make sure emergency drills are conducted, design modifications for the people you support, and staffing and technology, any safety devices, sprinklers, inspections. We want to make sure if you're not providing traditional services, like if you're providing services in someone's home where staff are going in, that you're checking the home, you're working with the families to support them, to be cognizant of the safety needs in that home and make sure there's any specific emergency equipment needed and that environments are clean and hazard-free. Okay, let's move on to factor 8. Or 7, sorry, I skipped one.
No worries, Betsy. Factor 7, staff resources and supports. So this is one of my favorite factors to dig into because a lot of this is really about the agency culture and how staff are treated and what kind of, and if they feel valued really. So a lot of the things that we look at, of course, we're going to look at policy to make sure they're fair and that they seem compliant with, local laws, depending on which country you're from or which state you're from. Often we look at the employee handbook. We look at performance evaluations where we can see, number one, if they're completed, if they're done. And number two, really to look at kind of the goals. Is it really based on, are the goals based on professional development? Or are they things like, Kate will show up on time, so things like that. Some agencies have contracts, almost always if they're unionized. So we would want to take a look at those. And some agencies contract their workers. So we would want to look at those too. Of course, we want to look at job descriptions to see how people's jobs impact the people receiving services. We look at training, all kinds of training that staff go through to see if staff have good training, kind of in the basics. And then also to see if staff have a say in the kind of training that they want or need. We look at what I call the 3 R's: recruitment, retention, and recognition plans, to see how staff are being hired and retained at the organization. And of course, we're going to find information in personnel files when we visit also. Some of the practices, really those focus groups that we've been talking about since the beginning, those focus groups really give us some key information around the kind of support staff receive from the organization, if their opinions are respected and valued or even just solicited. So we look at things like that. We have a lot of conversations. Even when we conduct an accreditation virtually, we're still chatting with people, just kind of in general around the agency culture. We look at the agency's practices on leadership opportunities. Are there ladders and things like that people can do to kind of improve their own professional skills. Clearly, we're looking at the relationships between everyone, really. We look at the relationships that are happening with staff and people receiving services. And I'm not just talking about, direct support staff, but any staff. And then among each other too. How does, leadership interact with, staff that are working directly with people receiving services, things like that. We look to see if an agency has a staff matching program of some sort, if that program is working. And of course, we're going to be visiting people where they receive services. So lots of stuff to look at there. A lot of this is regulated depending on where you are. So most often agencies have lots of policies around this. I love when agencies continue the work of focus groups after we leave, because I think that this information is absolutely valuable to organizations to learn from, at different levels of staff. So Kim Zeller continues to do this at the Ray Graham Association near Chicago. So factor 8, which is positive services and supports. Some of the systems that we look at, so this is all about the plan, the planning process and maintenance of the plan, positive support plans, mental health services, things like that. So we really look at here how the systems around how people are supported to choose their own goals, whether that be a mental health goal, a relationship goal, any kind of goal the person wants. We want to make sure that it's meaningful to the person and that the person chose it and that it wasn't chosen by someone else because, that other person might think that, they have some work to do. Obviously, we look at plans. We look at support plans, we look at treatment plans, we look at care plans, we look at, different plans for different therapies. What we're looking at there, we're looking at a lot of different things when we look at that plan. One thing is it accessible to the person? Is it meaningful? Does it talk about what the person wants to share? And then is that plan flexible? If I want to change my goal to do something completely different, how long does that take? Can I just call whoever helps me write my plan and say, hey, Betsy, I really have changed my mind about this. I want to do this instead. And, Betsy should be able to make those changes. So the plan should be flexible. We're looking at assessments. We're looking at different policies around plans and how they're supposed to be written. We're looking at staff training. How are staff trained in the implementation of a plan? Beyond just staff having access to it. Is there someone who is teaching the staff how to support me to reach my goals? The practices that we look at here, obviously, we're going to do some focus groups. We're going to look at the responsiveness of the changing support needs. So if, somebody, let's say, has a mental health crisis, how is the plan changing to support that person as they are, as that crisis is being resolved? We want to also look at not only are the staff trained to implement it, are they actually implementing someone's plan? Because that's obviously very important. Why have a plan if you aren't going to follow it? And then clearly we're having conversations with all kinds of people about different things that are happening in their lives. So factor 9 is about those administrative supports that agencies, most agencies have to kind of fit within or to be able to just run their business. So, we look at mission, vision, values, we look at policies around finances and record keeping and money management. If an agency is supporting someone to manage their finances, how are they doing that? This is also where we look at the licensing documents an agency may have, surveys from states or surveys from local governments, however your system works. We want to look at those. We also want to see your organizational chart and kind of some of your administrative policies around repairs, if you actually own places, or things like how you help someone find housing, things like that. So again, where we find this information is really conversations with people. We ask about, financial viability of the organization, like things like how many operating days of capital do you have, and, how that organization may be carrying out its financial practices to make sure that it's continues to be viable. Focus groups from all different parts of the organization, perhaps even family members. And then, of course, we always visit people to see how services are being provided. So Betsy, I'm going to have you finish up with factor 10.
Very good. I love this statement too. The previous slide said a good system shortens the road to the goal. So when you think about factor 10 basic assurances system, this is the area that scares people a little bit. The one thing I suggest to people is that you find a way that a policy or procedure that really maps the data you'll collect and a good structure for a system. So when you look at the probes and the basic assurances, turn them into statements, you can really create a nice policy or a plan around that. So whatever your mechanism or committee that's responsible for the collection, the analysis, and action could include people, staff, families, or other stakeholders. You want to make sure you know who's responsible for the collection of the data and make sure it's an effective system that will have a delegation of responsibility and accountability for collection. You don't want to create a lot of additional work for people. Honestly, do what works for your organization and start with the data that you already have and allow that system to evolve. Make sure key function and activities of the organization relate to the basic assurances. And you probably, like I said, have data that you already have collected, but make sure it's meaningful. You probably already track data regarding staffing from HR, you're doing instant reporting data, you have rights data. There's a lot of really data systems you already have. Make sure when you think about data, when you think about stories, Qualitative data is really descriptive information about people. That's why we talk about stories. They're difficult to define numerically. So be careful about that. When you show data, you want to make sure it's meaningful. So when you share data with people, not everything needs a graph. You want to be real careful with that. You want to make sure that although all the hard work you put into exploring and analyzing your data, sometimes that clutters everything up for people. So you want to make sure it's meaningful for people and understand who you're communicating with when you're sharing that data out to people. You want to be an explanatory space, meaning you'll have a specific thing you want to explain to people, a specific story you want to tell, because data is about a story. So stories you can turn into data. And when it comes to person outcome measures and data, the portal really also helps organizations and agencies with reporting, tracking, analysis, and logging data about personal outcomes and supports for people receiving services. So there's a lot of ways you can use portal in Palms and looking at that. Practice is conversations and visits with people, families, staff, and stakeholders. In fact, we want you to do that. We want you to engage people in terms of collecting the data, learning about the data, and also do that plan, do, check, act, analyze that data and get everyone's feedback. Okay, a lot of people are great at planning and doing. Checking and acting are always a struggle for all of us because it's like a lot to look at, but we want to look at what it reveals. We want to see what the trends and the actions that are taken. Personal outcome measures, again, we want to make sure we're looking at those things. Even smaller organizations can use personal outcome measures to monitor basic assurances. Small organizations that support few people, but organizations that support a lot of people can use that as a supplement to monitoring their quality improvement plan. Any kind of success stories you have, you want to make sure they demonstrate compelling and uncluttered visuals. So when you tell a story, it's not just showing videos and so on. You can show a story through data. You want to make sure that you can show things because graphs are not all equal. You want to make sure that your graphs tell the story that you're trying to do, going back again to that system, that relevant and meaningful data. I love this quality equals connections to people. What type of connections are you making with people and how do you measure that? That again goes back to looking at stories, looking at interactions. So remember that the quality of connections truly is based on the quality of interactions you really truly have with people. And we always want to think about reciprocity in action, or simply we might be able to observe quality anecdotally through maybe affirmative, respectful interactions with people. People giving back to the community. There's a quote that I don't have a slide for, a woman named Polly Murray, who was an American civil rights activist, who became a lawyer and gender equality advocate and author. She says, true community is based on quality, mutuality, and reciprocity. It affirms the richness of individual diversity as well as the human ties that bind us together. Reciprocity is key. So when we think about this and wrapping up this webinar, there are multiple ways to show evidence of basic assurance factors. We've shared that with you. Again, going back to that basic assurance manual, have conversations with people. Go back to where it says preparing for evidence collection in your manuals. Be creative, tell stories, take pictures. We've had so many people share with us so many brilliant videos of people engaging in and doing amazing things and really living your dreams in their life. Capture success stories and learning moments so that you can share them. We have a lot of those on our website, different success stories that many people over the years have done in their lives, traveling or getting a driver's license, so that dream job they want, or having that dream relationship. So when you think about showing appreciation and celebrating things, you want to celebrate with people within your organization when things happen that align with basic assurances. Great way to show appreciation is to celebrate a job well done. Celebrations truly boost morale, strengthen teams, and help employees form connections and increase engagement. It helps everyone. Thank you. Next slide. So I just would like to point out that you can connect with us through Facebook, Twitter, YouTube, LinkedIn. We regularly post a lot of articles and information for human service providers. We encourage you to enjoy our e-community on Facebook, where members share resources, ask questions, provide support, and identify solutions for common challenges. There's a lot of people answering on that, and it's a really great channel to look at. Just to put out there, our 2020 CQL conference, we will be in Vegas. This is very exciting. It's called Lightbulb Moments. It's in Las Vegas on 10/11/22. That's Tuesday the 11th through Friday, October 12th. The event will bring innovation in the services sector out of the dark. The presentation will not be focused on theory, but practical, actionable content with specific tools, resources, and information you can use within your organization. We do begin this with a National Leadership Consortium pre-conference, and that's in person only on Tuesday, 10/11. The CQL conference is actually from October 12th to Friday through Friday, and it's a fully hybrid event, so you can attend either in person in Vegas or virtually through Zoom. Events platforms where all session will be live streamed. So you can look at that information around that, early bird, as well as the last moment when you want to register for this by visiting our website, CQL Conference. Don't hesitate to contact us, Kate, Betsy, and Kristen. And we have upcoming webinars for the rest of the year. There's more that are part of our 2022 webinar series. You can learn more about those and find the links to register by visiting our website. And I believe Seth is posting that link in the Zoom chat box right now. All right. Any questions?
So, Betsy, we have actually had quite a few questions in our question and answer box, and I want to start with some of those. Some of them were already answered, but some of them I'm going to repeat the answer to. Someone asked about Human Rights Committee meetings, sorry, if they should have their own, or is it okay to go with their local Human Rights Committee? And this actually is up to you. If you want to use your local committee and it is doing the things that you want them to do, so they're actually promoting rights and, are about not restricting people's rights, then, it's okay to go with your local. If you would like to start your own, please contact us and we can certainly support you to connect with agencies and give you some resources about human rights committees. Betsy mentioned the basic assurances guide that we have, and every factor has a page of ideas for information gathering. So it's usually, the introduction of the factor, and then it's the different indicators and probes, and then there's ideas for information gathering. So not just factor 4 has that, but it's every factor that has that information. Someone had a question regarding staff matching. And what we mean by that is if you are, let's say you're doing, in-home support for people and you're having, personality conflicts, things like that. One of the things that we find is that once you really get to know people, it helps with retention if you match the staff with the person receiving services. So for instance, if someone has common interests. So let's say that Kristen is supporting me to find a staff member to support me. And I really, really, really like to go to the ballet. Okay, so Kristen knows through, serving and things like that, that Betsy as a staff member loves the ballet and knows a lot about it. So perhaps it would be best for Betsy and I to be paired so she can support me. Obviously, that's not going to happen 100% of the time. Betsy's not going to be able to be my staff 24 hours a day, 7 days a week, if that's the support I need. But, looking at that really does help with retention, and it also helps people live a better life. So I had a question about safety drills. It really depends how often you do safety drills. Typically, agencies that are providing services 24 hours a day, 7 days a week, kind of a group living, a lot of that is answered by your local or your state regulatory bodies. Some people do them once a month, some people do them once a quarter, some people do them once a year. It just depends. What matters to us is that people know what to do if there's an emergency of some sort. So do I know what to do if I live in North Carolina and there's a hurricane coming? What kind of support do I need to get out of that situation? So that's really the important part of the safety issues for us. One other thing is you make sure that assessment's individualized. Betsy hit on that with factor 6. So what happens when there is some sort of emergency. Let's say there's a fire, or the fire alarm's going off, and I don't like loud noises, so I run to hide in the closet. So it's important for Betsy to know, as my support staff. Betsy, I'm sorry I'm putting you in that position, but so Betsy, as my support staff, should know that I run and hide in the closet when the fire alarm goes off. So that kind of thing is what really matters to us. It's not the frequency, it's the impact that they're having. So other questions? Sorry, I'm trying to.
There's one that just came up. I'll answer
Sure,
the
Betsy,
one.
go ahead and take it.
I'll answer the one
Sure.
about the quote, but Kate, there's one that someone asked about assisting agencies that's immersed in binder centric. So let me answer the one about the quote. This quote is by a woman. Her nickname is Polly Murray. She passed actually away in 1985. She was an American civil rights activist who became a lawyer and gender equality advocate and author. And just because it is a very cool quote, I do love it and I'll read it. True community is based on equality, mutuality, and reciprocity. It affirms the richness of individual diversity as well as the common human ties that bind us together. And that you could really see that in elements of all our basic assurances and what really matters, but more specifically as well in shared values.
Wonderful, thank you, Betsy. Another question was resources for self-advocacy. We can certainly hook you up with some connections and some resources. Feel free to reach out to anyone on this call, or you can also do info at the council, and we can certainly help you with some resources for that. One other question was about, I keep losing it, I'm sorry. Okay, a binder-centric culture. Betsy and Kristen, feel free to jump in here. When I was working for a provider and was accredited by CQL, we literally had massive amounts of paper. It was binder after binder after binder after binder to really make sure that we were giving the reviewers the information that they had requested and that they needed to make good decisions. So I think one thing that I will say, it's really not about the amount of information you give us, it's the quality of that information. So we want to see a representative sample kind of different things. Sometimes we choose what we want to see. Let's say that I'm looking at factor 7 and I want to review some files. I will probably give you some names of people that were in one of my focus groups, or I may just say, depending on the type of agency, I may just say, give me examples of 1 or 2 of these. So that's one way to do it. The other thing, if this question is about paper versus electronic, then I think that can probably be a whole other webinar. But that's what it's rare now that we go to an agency and get binders of information, if you're talking literally about binders. Kristen and Betsy, do you have anything you'd like to add?
You know, I love the fact, Kate, that you said it depends on the quality of what you share with us. I think that's key, particularly through this
Mhm.
pandemic. CQL really started looking at data around a lot of things. So if we start seeing trends and things, we would see that quality of what was done and the actions taken. I love to
Mhm.
say to people in personal outcome measures, the quality of the answer you get will be based on the quality of the question you ask people. And that is the same thing when it comes to sharing out your evidence around your basic assurances systems and how you demonstrate that through your practices. And that really is that quality piece, that
Mhm.
connected you make with that.
And then as far as the other part of that question was around a shift in thinking for, possibly senior leadership of the organization. Um, the CQL has a lot of data, and a lot of that data is on our website under research. So if you want to convince someone using data, I would highly recommend that you go there. We have a lot of research on managed long-term services and supports that connects social determinants of health with the basic assurances and personal outcome measures. So feel free to take a look at that. If you want to, please feel free to reach out to any of us, and we would be happy to, have a conversation about that. Um, you know, s- Sometimes it takes a while, to do that, but it really is a culture shift.
Yeah,
So,
it looks like Jane, you had a question regarding focus groups, and really quick. So when we come for accreditation, we do meet with each group separately. So it would be all the DSPs together, all the people supported. And we ask, that there's no staff present if possible for the people supported, unless they need help with communicating. And we ask for no supervisors for the DSPs, just because it really changes the way that people answer questions. It's the same for us. If someone were to ask us something and people were around, we might answer differently. But we find it's a really great way to get a lot of really hardy information. And a lot of times, since we're kind of a unknown, a stranger, people really feel free to open up. So yeah, so that's kind of what that looks like to answer your question.
And we can do focus groups. We ask what you would like to do. Family focus group, partners. We've worked with different types of focus groups in a clinical organization where they provide more clinical supports. I did a focus group with clinicians, a focus group with more
mhm.
direct support, not necessarily clinicians. I did a separate focus group with psychologists. So it was all very much focused and formed around what the organization needed to create that quality evidence to share with us in practice.
Great questions, guys.
Yeah, absolutely. We love this part of the webinars is answering the questions. So again, feel free to contact us. Seth has put our contact information in the one of the boxes, the chat box, I believe. So you can contact us. Our contact information is also on our website. If you aren't furiously taking notes, you can certainly contact us from our website.